Hello everybody and welcome back to the A to Z. This month's edition is the letter M, so we'll be talking about MTSS. So Alicia, what is MTSS?
So MTSS stands for Medial Tibial Stress Syndrome, also known as shin splints. There's two schools of thought with what causes it. So it's either muscle related or bone related, and most research now is kind of pointing towards it being bone related. So stress on the bone, overuse, it's thought to be that twisting of the bone through exercise.
Okay, lovely, thank you. Okay, so now we know what MTSS is. What are the symptoms? How does it present itself in clinic? So
symptoms, patients will complain of pain along the end kind of part of the medial shin there. They'll describe it as kind of, it occurs with exercise. And normally it's not so bad that the patient has to stop exercising. So normally people can push through it, but it does continue. And then within 48 hours after exercise with rest, it should resolve and settle down a little bit.
Okay, so how would you diagnose it in clinic?
So we take a full patient history. So history is probably the most important factor here. And we might palpate the area just to see if there's any kind of tenderness and stuff like that.
Palpate down here?
Yeah, so you just like palpate along, and it's usually within about a 5 centimetre radius that it's painful on palpation. We might get you to run on the treadmill a little bit, see if we can kind of reproduce that kind of pain, but often we can gather that through history taking.
Okay, and who do you often see in clinic? So who's more at risk to something like this?
So the people that are most at risk tend to be runners, so people that are running a lot as well. Terrain, it depends on terrain. Sometimes I think we see it more with road runners, just because of that higher impact load. So it tends to be runners, people that do a lot of activity, and it tends to be more, it depends on how you run as well. So we look at that a lot in clinic, kind of how your gait is and stuff like that. Cool.
Okay, so now we know what it is, we know how it presents in clinic, we know who's at risk and how you diagnose it. How do you treat it?
So for treatment, there's a few things that we can do. First of all, you want to kind of offload that shin area. You want to reduce the force that's going through that bone. And you do that by footwear. So you can have shoes that have a bit of a rocker sole on them. So you're taking away that impact and you can shock absorb as you're going through. Perfect.
So I can show you there. So it's a little, it's that motion.
Yeah, no, that's good. Yeah, so a shoe like that is great. That's probably the main thing we focus on in the very early stages.
Yep.
You can put orthotics in as well, so you can use orthotics which are a carbon plate which put your foot in that kind of rocker position as well. So there's a few options with that, and then depending on your gait we can do other orthotic modifications. So that's kind of all offloading, and then how we kind of offload it even further and prevent it reoccurring in the future is we can look at your gait cycle and see how you're running, because often people with MTSS tend to land with more of a straighter leg, and that puts more impact through the tibia, and there are other factors in your gait cycle that can kind of increase that load through the bone as well.
So you sort of mentioned it there about prevention. Say I have MTSS, what would you tell me? What can I go away and do to help prevent that reoccurring?
So preventing it, I would say you definitely want to do all the footwear and everything like that. You want to keep exercising through it, because we don't want you to lose that muscle mass if you're just not exercising at all. That's really key. But it's kind of adapting your exercise to ensure you're kind of warming it up a little bit.
But I shouldn't be afraid of not exercising.
No, not at all. No, never be afraid to do exercise. That's quite a big thing to note, because we want you to, the more muscle mass you have, the more you're kind of offloading, and the muscles can take that load and keep that stability in your lower limb. So basically, the more muscle you can get, the better for the long run with MTSS.
So movement is medicine in that sort of sense.
Yeah, definitely.
And how long am I going to be out for What's the sort of timeline for me to recover from it?
I would say you don't really need to be out very much with MTSS, because you can often exercise through it, but it would be about modifying the exercises that you're doing. So here we have rehab specialists that will go through programs where you can modify that exercise so you're still getting it in, but you're just trying to build up that muscle mass more and stuff like that. So I would say, if you're not doing any strength training, you need to be with MTSS, and you might have to adapt your runs slightly as well. So maybe shorter or quicker runs. Yeah.
Okay, yeah. Lovely. Thank you very much. I think we know what it is, how it presents, how we can recover from it, and what to do. So thank you very much.
Thank you. Thanks.
Thank you, everyone.